Cardiovascular pharmacology, cardiac glycosides. Digoxin. Digoxin is a cardiac glycoside medication that has been used for centuries to treat heart failure. It has three effects on heart muscle: positive inotropic action, which increases contractility, stroke volume, and thus cardiac output; negative chronotropic action, which means that it decreases heart rate; and negative dromotropic action, which means it decreases the conduction of cardiac cells. The mechanism of action. Digoxin works by inhibiting the sodium and potassium pump, which results in an increase in intracellular sodium and an influx of calcium into cardiac cells, causing the cardiac muscle fibers to contract more efficiently and increase cardiac output. This medication is used as second-line treatment for patients who have heart failure or atrial fibrillation. Due to the risk for digoxin toxicity, the clinical use of digoxin has decreased and alternative safer medications are being used. Nursing considerations. The apical pulse must be taken for a full minute before administration of this medication. If the apical pulse is less than 60, the dose should be withheld and the prescribing provider notified. Serum digoxin levels should be monitored with a normal therapeutic range from 0.8 to 2 nanograms per milliliter. Serum potassium levels should also be closely monitored for patients on digoxin because hypokalemia increases the effect of digoxin and can result in digoxin toxicity. Normal potassium level is 3.5 to 5.0 milliliters equivalent per liter, and a result less than 3.5 should be immediately reported to the provider. Medics should closely monitor signs of digoxin toxicity. Geriatric patients have an increased risk for developing digoxin toxicity, and Digibind is used to treat digoxin toxicity. Adverse side effects. Overdose or accumulation of digoxin causes digoxin toxicity. Signs and symptoms of digoxin toxicity are bradycardia or heart rate less than 60, nausea, vomiting, visual changes, including halos, and arrhythmias. Cardiotoxicity is a serious adverse effect with ventricular dysarrhythmias. Toxicity of this medication typically occurs at greater than 2 nanograms per milliliter, but some patients may have signs and symptoms at lower levels. Pediatric patients typically present with bradycardia or arrhythmias if toxicity is occurring. Decreased renal function, hypokalemia, hypercalcemia, and hypomagnesemia may increase risk for digoxin toxicity. Common side effects include GI symptoms, headache, weakness, dizziness, anxiety, depression, delirium, and hallucination. Patient teaching and education. The patient should be instructed to follow the prescribed dosing regimen and take medications at the same time each day. The patient should be cautious not to double up on medication doses. Additionally, the patient should consult the healthcare provider if 2 or more doses of medication are missed or follow-up instruction. Patients should receive education regarding pulse rate monitoring and report any pulse rate less than 60. If the patient experiences signs of digoxin toxicity, this should be reported to the provider immediately. The medication should be stored in its original container, and care should not be taken not to mix the medication with other medications. Anti-Anginals Nitrates. Anti-anginal medication is used to treat angina pectoris. Angina is chest pain caused by inadequate blood flow, resulting in hypoxia of the cardiac tissue. Angina can be chronic pain caused by atherosclerosis in coronary artery disease or acute pain caused by a myocardial infarction. Anti-anginals increase blood flow to the heart or decrease oxygen demand by the heart. Nitrates promote vasodilation of coronary arteries and veins. Beta blockers and calcium channel blockers are also used to decrease workload of the heart and decrease oxygen demands. Nitrates may come in a variety of routes, such as sublingual, extended-release tablets, creams, transdermal patches, and intravenously. Sublingual tablets are prescribed PRN or as needed for patients who are experiencing chronic stable angina due to coronary artery disease. The mechanism of action: nitroglycerin relieves angina by relaxing vascular smooth muscle, resulting in vasodilation. The indications for use are: nitroglycerin is used to relieve angina due to coronary artery disease during times of an acute attack or prophylactically. Considerations: patients taking sildenafil or Viagra or similar medications for erectile dysfunction in the previous 24 hours may not take nitroglycerin, as this may result in a dangerous drop in blood pressure. Nitroglycerin should not be used in pregnant women or those who are breastfeeding. Nitroglycerin is contraindicated in patients who have severe anemia, increased intracranial pressure, hypersensitivity, or circulatory failure. Side effects: patients taking nitroglycerin may experience hypotension, palpitations, headache, weakness, sweating, flushing, nausea, vomiting, or dizziness. Patients should allow medication to dissolve under their tongue. This route allows immediate absorption into the circulation and avoids first-pass metabolism by the liver. Patients may take up to 1 tablet every 5 minutes, up to 3 sublingual tablets within 15 minutes to relieve chest pain. If chest pain is not relieved after the first dose, emergency should be called. Nitroglycerin may also be used prophylactically 5 to 10 minutes prior to engaging in activities that might precipitate an acute attack. Patient education: instruct patients to avoid eating or smoking during administration, as this may alter absorption. Patients should sit during administration to decrease the risk for injury due to the possibility of hypotension, dizziness, and weakness. Nitroglycerin decomposes when exposed to heat or light, so it should be stored in the original airtight glass container. Historically, patients have been taught to seek emergency help if pain persists after the 3rd dose of medication. However, new guidelines from the AHA urge patients to call emergency after the 1st dose if symptoms are not improved or become worse.